Ladies and gentlemen, today I'm going to show you where to guasa for those with asthma. Asthma is a very serious disease, especially during cold season or during haze season. And normally if you see doctor will advise you to take medication, but with just a guasa board, you can just treat your asthma very effective and very simple. You should give guasa a try. It's very simple to do. Just guasa on the hand about 25 to 30 times and then you will see the result. And then your breathing also will get easier just by simple stroke of guasa only. This is a diagram where you must guasa for those with asthma. You can refer to the Elken product guide book made available to you. All the red patches that you can see here, including the arm, you must guasa. So you can see from here, just apply a thin layer and you guasa those areas. So we started with the backbone area. So this is a backbone, and then we use the guasa the other two line. So first you apply a thin layer of Elken guasa oil, and then after that use a guasa board to even out the oil on the body. After even out, you start with the backbone area. Use the edge of the guasa board. You guasa about 25 to 30 times using a moderate strength until you can see the red patches of SAR appear. As you can see, is done by our Professor Dr. Lu. Then using the distance of a 2 finger, you guasa the next meridian line on the left. So you guasa about 25 to 30 times using a moderate strength until you can see the red SAR appear. The darker the SAR appear, the more toxin the body is. Then another 2 finger, the distance of a 2 finger on the right side, and guasa again. So you can see the 3 meridian from this guasa. Just using a simple stroke, moderate, not so hard. Just scrub downwards until you can see the red patches of SAR appear like this. See the red patches of SAR appear. These are the toxin in the body. So you can scrub 25 to 30 times. Then the chest area, apply a thin layer of oil, apply from the middle of the body and scrub the chest area 25 to 30 times using the moderate strength. You press and you scrub outwards area. Press to the middle, scrub out until you can see the SAR appear. Do it on both chest area. You can see from the diagram here, from the video here, that's what the professor will do. So then the other side also, scrub 25 to 30 times outward area, guasa outward until you can see the red SAR appear. Then there's an important point called Chanzhong at the middle here. From middle here, the middle of the body, you scrub downwards also, and there's an important point here called Chanzhong in between the 2 nipples. So you trigger this point because it's very important for people with asthma. Then the arm area. The arm area, this is an area that you must guasa. Apply a thin layer of oil, even out the oil using the guasa board. Then you scrub 25 to 30 times. Actually, guasa is very easy. Just apply a thin layer of oil and just even out, and then you guasa the area like this 25 to 30 times, moderate speed, moderate strength. Guasa until you can see the red patches of SAR appear, and you guasa here all the way until the thumb, the end of the thumb area. Just scrub moderately until you see the SAR appear. So just scrub like that. This is super effective for those people with asthma problem. So just scrub like that 25 to 30 times, moderate strength. You can apply some oil if you think that is not enough, and scrub the palm area to the end of the fingertip. So you must apply. Now this is a very important point also. People with asthma, when you guasa this point, you ease your breathing. You help in your breathing. So after guasa the arm, go to the waist area, the back area. So the back, apply a thin layer of oil in this point, then even out, and then start guasa 25 to 30 times. This is a very important point for people with asthma. So you scrub 25 to 30 times until you see the SAR, and if you don't see the SAR, it's okay, you just scrub 25 to 30 times. So scrub 25 to 30 times until you see, and the person will feel very effective, feel very good. So just scrub downwards 25 to 30 times, just like what done by Professor Lu here.